Hello guys, welcome to Basic Nursing Classes. Myself Amanpreet. In today's video, we are moving on with our topic hyperthyroidism, and in this video, we are going to move on with our management. Okay, and the management we are talking about over here the surgical management of hyperthyroidism. Okay, and that surgical procedure is known as thyroidectomy. Okay, and this procedure, it is the most common way used in hyperthyroidism. Okay, so let's move on. Basically, surgical removal of thyroid gland, it is of two types. First is total removal and second is partial removal. In that we do not remove the whole gland, we remove the some part of thyroid gland. Okay, that is subtotal. And complete removal of thyroid gland, that is total thyroidectomy. Okay, and in total thyroidectomy, because there is no thyroid gland left in place, so we have to take lifelong replacement of thyroid hormones, because there is no gland in the body to produce these hormones, so we have to artificially take all the hormones, and that hormone that we take for the lifelong, that is levothyroxine. Okay, and that condition automatically becomes the condition like hypothyroidism. Okay, and we have to watch for that sign and symptoms of hypothyroidism over here. Okay, and moreover, apart from hypothyroidism, there is one more risk related to total thyroidectomy, that is the risk of hypocalcemia, because of the parathyroid gland. And when we remove the thyroid gland, we know the parathyroid gland, these are basically located under the thyroid gland. And when we are removing surgically the thyroid gland, there are chances, most of the chances, that there is accidental removal of parathyroid gland also. And parathyroid gland, they are responsible for maintaining the level of calcium in our body. And if they are removed accidentally, so there is risk of hypocalcemia. Okay, so in addition to hypothyroidism, we have to check for the sign and symptoms of hypocalcemia too. Okay, so remember both. And the hypocalcemia signs, we already know there are basically two signs. First is Chevostic sign and second is Trozo sign. Okay, so remember both. And in subtotal thyroidectomy, because there we are removing the only the partial gland, so there is no risk of hypocalcemia over there, and there is no need for lifelong replacement of thyroid hormones. But there is risk for thyroid storm. Either the hormones can go up or they can go too low, that is thyroid crisis, which is also known as mixed edema coma. Okay, so we have to watch for both. Okay, so that's the main difference between total thyroidectomy and subtotal. Okay, and after thyroidectomy, we have to be very careful about the post procedure nursing management. Okay, and first 12 hours, the patient is at high risk for any airway obstruction, and second condition is patient is at risk for hemorrhage. Okay, so we have to look for these both symptoms in first 12 hours. In first 12 hours, there is no risk of infection, but there is risk of airway management. Okay, airway obstruction, sorry, and there is risk for hemorrhage. We have to look for both. Now, how to look for airway obstruction? The main sign symptom over here after thyroidectomy, that there can be presence of high pitched, vibratory and harsh sound. Okay, patient can make high pitch, vibratory and harsh sound, which is also known as laryngeal stridor. Okay, that is the main indication of airway obstruction, and that's an emergency condition. Okay, in that condition we have to get oxygen ready because the airway is being obstructed. Okay, plus keep the suction ready. Okay, we may need it. Okay, plus we have to place the tracheostomy tray on the bedside, because if the pathway is not clear, in that case we have to do the tracheostomy too. Okay, so remember these airway obstruction symptoms. Okay, and what to do if there is airway obstruction. Plus we have to get the semi-phallus position, okay, to maintain the airway. And after that we have to check for any neck swelling. Okay, it's very common. And after 12 hours, in 12 to 48 hours, there is no high risk of airway obstruction or any risk of hemorrhage, but there is risk of low calcium levels because of accidental removal of parathyroid gland. Okay, if there is total thyroidectomy, or there can be thyroid storm, or there can be thyroid crisis if that is subtotal thyroidectomy. Okay, these can happen in 12 to 48 hours, and after 48 hours or after 72 hours, then we have to check for the sign and symptoms of infection, not before 72 hours. Okay, after 72 hours we have to check for the sign and symptoms of any infection like fever. Okay, that's the main basic cause, basic symptom. Okay, and apart from these, the patient has to be provided with high calorie diet. Okay, at least 4000 to 5000 kilocalories. Okay, because the patient is having hypermetabolism in hyperthyroidism, and the diet should be rich in carbohydrates, proteins, fats, minerals, vitamins. Okay, and basically the patient has to take 6 full meals. Okay, plus snacks in between. Okay, because patient is having high metabolism. Okay, and patient has not to be given caffeine, no caffeinated products like coffee, tea, energy drinks. Okay, and no intake of spicy foods. Okay, and that's all with the management. Okay, the nursing management, the nurse should know all these points from the clinical point of view and from the exam point of view. Okay, so thank you. I hope you guys are liking my videos. Okay, good luck.